Hormonal birth control is one of the most widely used medical interventions in women's healthcare. In the United States, more than half of women between the ages of 15 and 49 are currently using some form of contraception. And across a woman's lifetime, roughly 9 out of 10 women will use contraception at some point. For many women, that exposure begins early, often in adolescence, sometimes years before they're ever taught how their menstrual cycle actually works. Hormonal methods, including the pill, patch, ring, injection, and hormonal IUDs, make up a large portion of contraceptive use. The pill remains one of the most commonly used reversible methods and is frequently prescribed not only for pregnancy prevention, but for acne, painful periods, irregular cycles, and other hormone-related symptoms. Many women stay on these medications for years, sometimes decades, without ever being clearly told what hormones are being suppressed, what's being replaced, or how those changes affect the body over time. What's missing from most of these conversations isn't access. It's education. Education about ovulation, about progesterone, about how the brain, ovaries, and the endocrine system communicate, and about how stress, sleep, nutrition, and training interact with hormones. So when symptoms show up, fatigue, anxiety, mood changes, low libido, many women assume something is wrong with them. This video isn't about telling women what choice to make. It's about explaining what hormonal birth control actually does so that choice can be informed. Because you can't give real consent to something you don't understand. To understand the impact of hormonal birth control, we first need to be clear about what it is and what it isn't. Hormonal birth control does not restore balance. It does not correct an underlying hormonal problem, and it does not regulate a natural menstrual cycle. Instead, hormonal birth control works by introducing synthetic hormones into the body, hormones that override the body's own hormonal rhythm. These hormones are exogenous, meaning they come from outside the body. Synthetic estrogen is not the same as the estrogen the ovaries naturally produce. And progestions are not the same as progesterone. That distinction matters. The natural menstrual cycle is a coordinated, cyclical process. It involves communication between the brain, the ovaries, and multiple endocrine organs. Hormones rise and fall in a specific sequence, not just to control fertility, but to influence mood, energy, metabolism, sleep, and stress resilience. Hormonal birth control replaces that dynamic system with a steady, externally controlled hormonal signal. This is why birth control is sometimes described as regulating hormones, but physiologically, what it's doing is suppressing the body's own production and replacing it with a synthetic pattern. For many women, this suppression reduces symptoms in the short term, but suppression and resolution are not the same thing. Most hormonal birth control methods prevent pregnancy primarily by suppressing ovulation. Ovulation is the moment when the ovary releases an egg, but ovulation isn't just about fertility. Ovulation is the event that drives the second half of the menstrual cycle. After ovulation occurs, the ovary produces progesterone, a hormone that plays a critical role in stabilizing mood, supporting sleep, regulating the nervous system, and preparing the body for a possible pregnancy. When ovulation is suppressed, that entire phase of the cycle disappears. Without ovulation, there is no luteal phase. And without a luteal phase, the body is no longer producing its own progesterone. This is one of the most important and least explained effects of hormonal birth control. In addition to suppressing ovulation, hormonal birth control alters cervical mucus, making it more difficult for sperm to travel. It also thins the uterine lining, reducing the likelihood of implantation. But ovulation suppression remains the central mechanism. This means that while someone may still experience bleeding on birth control, the underlying hormonal sequence that defines a natural cycle is no longer taking place. The brain is no longer sending the same signals to the ovaries, and the ovaries are no longer responding in the same way. This matters because it explains why bleeding on birth control isn't the same as a natural menstrual period. This is also where a lot of the confusion begins. The monthly bleed that occurs on most birth control pills is often described as a period, but physiologically it isn't. What's happening is called a withdrawal bleed. During the pill's placebo or hormone-free interval, synthetic hormone levels drop. That sudden drop triggers the uterine lining to shed. This bleeding is not the result of ovulation, and it's not the end of a natural menstrual cycle. A true menstrual period only occurs after ovulation, and ovulation is what leads to progesterone production. When progesterone naturally falls at the end of the cycle, menstruation occurs. Without ovulation, that hormonal sequence doesn't happen. This means someone can bleed every month on birth control and still not be cycling. Bleeding does not automatically mean the body is producing its own hormones in a cyclical manner. It simply means synthetic hormones were removed. The withdrawal bleed was originally included in early pill designs to mimic a natural cycle and reassure users. But over time, it contributed to a widespread misunderstanding that the pill gives you a period. But it does not. The menstrual cycle isn't just about bleeding. It's a vital sign that reflects overall health. Pills, patches, rings, injections, hormonal IUDs. Hormonal birth control comes in many forms. While these methods look different, most rely on the same basic principle: introducing synthetic hormones to suppress the body's own hormonal cycle. What changes from method to method isn't just convenience, it's how those hormones enter and move through the body. Oral contraceptives are absorbed through the digestive system and processed by the liver. Patches and rings deliver hormones through the skin or vaginal tissue, entering the bloodstream more directly. Injections and hormonal IUDs release progestins continuously over time. These differences affect hormone levels, metabolism, and side effect profiles. Progestin-only methods reduce ovulation in some users, but not all. Combination methods suppress ovulation more consistently, but in every case, the hormonal environment is being altered either by suppression, replacement, or both. Non-hormonal options like the copper IUD work differently. They don't suppress ovulation, but they come with their own physiological trade-offs and considerations. No method is neutral. Each comes with a distinct mechanism and a set of effects. This is why one person can tolerate a method well, while another experiences significant side effects. And it's why just switching methods doesn't always solve the problem. Mood changes, fatigue, anxiety, low libido, sleep disruption, weight changes. These experiences are often grouped together under the term side effects. But they're not random. Hormones don't act in isolation. Estrogen and progesterone interact with neurotransmitters in the brain, including serotonin, dopamine, and GABA. They influence how the nervous system responds to stress, how the brain regulates mood, and how the body transitions into sleep. When ovulation is dampened and progesterone production is reduced or absent, those downstream systems adapt. Estrogen also affects blood flow, connective tissue, and metabolic signaling. Changes in estrogen exposure can influence appetite regulation, insulin sensitivity, and fat distribution, even when calorie intake hasn't changed. These responses don't mean the body is malfunctioning. They mean the body is responding to a different hormonal environment. Labeling these responses as side effects can obscure what's actually happening. They are signals, not character flaws. Hormonal birth control is often prescribed not only to prevent pregnancy, but to manage symptoms. Painful periods, acne, PMS, irregular cycles, heavy bleeding. In many cases, birth control reduces or eliminates these symptoms, at least temporarily. But minimizing the symptom doesn't always mean the underlying cause has been addressed. Hormonal birth control works by suppressing the body's natural hormonal signaling. When that signaling is quieted, the outward symptom often disappears. The signal is no longer being expressed, but it also isn't being interpreted. This is why many women notice that when they stop birth control, the original symptoms return. Sometimes they return unchanged, sometimes they return more intensely. Not because birth control caused the problem, but because the problem was never resolved. This doesn't mean birth control has no place. For some women, it provides relief during a difficult season. But using hormonal suppression as a long-term solution can create the impression that the symptom itself was the issue, rather than a message from the body. If you're going to change a system as complex as your endocrine system, you deserve to understand what that system does. In medicine, informed consent means understanding the benefits, the risks, and the trade-offs of a treatment, as well as the alternatives. When it comes to hormonal birth control, informed consent should include knowing what hormones are being suppressed, what hormones are being replaced, how ovulation is affected, and what the long-term implications may be. It should also include an understanding of what the medication is designed to do and what it is not designed to do. Birth control can be an appropriate choice. For some women, it provides symptom relief, pregnancy prevention, or both. But a choice made without understanding isn't truly a choice. When education is missing, responsibility often shifts onto the individual, especially when symptoms appear. And that's where many women begin to blame themselves. In reality, the body is responding logically to a change in hormonal messaging. Understanding those trade-offs doesn't take agency away, it restores it. Because informed consent isn't about fear, it's about respect. Hormonal birth control has played a significant role in women's autonomy, and that matters. Access matters, choice matters, and so does education. But autonomy without understanding isn't autonomy, it's compliance. When women aren't taught how their bodies work, they're left trying to navigate symptoms without context. And too often, that leads to confusion, frustration, and self-blame. Understanding physiology doesn't take options away. It expands them. It allows women to weigh trade-offs honestly, to ask better questions, and to make decisions that align with their health, their values, and their lives. This conversation isn't about telling women what to choose. It's about making sure women understand what they're choosing. Because when women are given the full picture, they don't lose their agency. They reclaim it. If you like this video, please hit the like button and subscribe. And if you're interested in learning more about hormones, lifestyle, and birth control, you can check out my book, The Birth Control Illusion. Officially comes out on February 26, 2026. Thank you.